5-minute medical lectures. Hello everyone. Welcome to the channel. My name is Octavio. And I am this lecture I-generated avatar. Today's lecture was developed by Dr. Nicholas Scormetta, specialist in orofacial pain. This is the first of a series of lectures about bruxism, developed for dentists, medical professionals and patients. Let's start with this lecture's topic. What is bruxism and how to diagnose it? What is bruxism? Let's define it. Bruxism is a motor activity or conduct characterized by the grinding or clenching of teeth and/or by bracing or thrusting the jaw. It is not a disease or condition, but rather a generic term used to describe two distinct motor activities: sleep bruxism and awake bruxism. It is important to highlight that the motor activities of awake and sleep bruxism may act differently under different individual circumstances. It may act as an innocuous behavior in some patients. It may also act as a protective behavior in some situations, or it can constitute a risk factor producing detrimental health consequences. It is essential to understand this variability to diagnose and manage bruxism accurately. Sleep bruxism is characterized by rhythmic masticatory muscle activity during sleep, whereas awake bruxism is characterized by sustained muscle activity during wakefulness. Bruxism may be a completely innocuous behavior with no harmful consequences. For example, some individuals may have bruxism, but have no symptoms and no evidence of damage to the teeth or jaw. In other cases, bruxism may act as a protective behavior, for example, preventing the airway from collapsing during sleep apnea events. Finally, bruxism may act as a risk factor, producing detrimental health consequences, such as tooth wear, jaw pain, headaches, and other complications. The prevalence of bruxism is higher among children and tends to descend with age, being lower than 5% over 50 years of age. The evaluation of sleep and awake bruxism can be done by interviewing the patient, by making a clinical assessment, or by using instruments mainly for measuring muscle activity. Instrumentally, sleep bruxism can be diagnosed using tools like polysomnography, which measures the electrical activity of the muscles, heart, and brain during sleep. In contrast, awake bruxism can be diagnosed using tools like electromyography, which measures the electrical activity of the muscles during wakefulness. Other forms of data collection, such as ecological momentary assessment, may help provide multiple time point reports over an observation period. The actual signs and symptoms related to sleep and awake bruxism are not entirely known. In sleep bruxism, the more sensitive symptoms include tooth grinding sounds, muscle fatigue, and headaches in the temporal muscles. Tooth wear is another sign of sleep bruxism, but it is highly specific but not sensitive. This means that tooth wear is a good indicator of the presence of bruxism when it is present, but it may not always be present in individuals who have bruxism. Clinical features of awake bruxism may include the presence of masticatory muscle hypertrophy, indentations on the tongue or lip, and/or linea alba in the inner cheek. The diagnosis criteria. Diagnostic criteria for sleep and awake bruxism are currently under review, and a new evaluation system called the Standardized Tool for the Assessment of Bruxism, STAB, is being developed. Experts recommend the use of a grading system to increase the likelihood of making an accurate diagnosis. The grading system used to diagnose bruxism includes three categories: possible, probable, and definitive. Possible bruxism is diagnosed when there is a self-reported history of tooth grinding or clenching. Probable bruxism is diagnosed when with or without a history of tooth grinding or clenching, and physical evidence of tooth wear or muscle tenderness. Definitive bruxism is diagnosed with or without self-report history and/or physical evidence of sleep and awake bruxism, but with positive instrumental assessment using polysomnography or electromyography. In conclusion, bruxism is a motor activity that may have various statuses, ranging from completely innocuous to a risk factor producing detrimental health consequences. Healthcare professionals must understand this variability to diagnose and manage bruxism accurately. If you enjoy our content and find it helpful, we would appreciate your support by subscribing to our channel. Your subscription will help our team of experts create more AI-powered medical content for dentists, healthcare professionals, and patients alike. If you're interested in continuing to learn about bruxism, please click the link to access more of our informative lectures. Thank you for your support.